KCM Wealth Management. Vancouver lawyers Dumel and Boscovich. The Vancouver Courier newspaper. David and Mark Goodman. Our guest is Dr. Brian Day. You all know him as the head man at Cambie Surgical Centre, and he has been really the loudest voice, the biggest proponent of mixing in private medical enterprise into our healthcare system, which of course he argues is already there in many ways. So we'll continue with our top 10 questions to ask your political candidates about healthcare, and very few, if any, are addressing this important issue. And we'll start with what I called question 5, really is question 6. And that's the question that you actually began to raise as we went to the break. World Health System ranked Canada 30th in the world, and yet we seem to spend, we're in the top 3 of worldwide spenders. Why this imbalance, and if you were a politician, what would you do to change that?
Well, there are quite a few reasons. By the way, I mean, I appreciate we're asking questions of politicians. Yes. As you know, yes. We're not likely to get answers to any of these questions, but I'll answer them.
Why are we not likely to get answers?
Well, politicians are afraid of this topic, and actually, in general, politicians don't like to answer questions unless it's something they've already got a rote answer to.
Yeah, and their middle name is obfuscation.
Right.
Yeah, Henry Obfuscation. Yeah. Yeah.
But part of the reason, I mean, there are issues with Canada. We are a very sparsely populated country for the size, but we have 14 health systems. We have 14 health ministries. We
Yes.
have 14, each of those 14 health ministers has deputy ministers, and they have assistant deputy and associate deputy. So we do have, contrary to the popular belief that of many, and contrary to what politicians will tell us, we have a system that's administratively bizarre. I mean,
all right, on that note, let me ask you something that isn't on our list at all. What do you make of the BC divisions of all these various health authorities, the Fraser Health, the Vancouver Coastal Health, and so on? I know what I make of it. I think it's a mess.
Well, what I don't like about it is to keep changing. I mean,
yes.
Because every time you change, everything's out of whack for a while.
Yes.
But the point I think that's important to make is that, for example, France, with twice the population of Canada,
yes.
has one health ministry that does the same job. So
hello.
So hello, we're not efficient, and we need to become more efficient. And maybe, and there has been talk of this, for instance, in the Maritimes,
yes.
joining all the Maritimes together as one health system,
yes.
and maybe BC and Alberta could have one health system. Now, you're not going to find a Minister of Health who's going to propose that as the end of his job.
I know of kids who are in care for addictions in the interior who, because of the mishmash health system, have to show up in various places in the Lower Mainland to talk to their worker or to talk to their shrink, or, you know, and the funding gets all caught up. Instead of saying, look, here's a kid who's being responded to in a good, positive way about an addictions issue, and let's fund that, and let's keep him where he is, let's keep him focused. Instead, they got this kid
Well, one of the big problems and why we're ranked lowly is that Canada has a system where we fund institutions with block funding, global
yes.
budgets.
Yes.
Every other developed country ties the funding to treating the patient. So for instance, when you go for an operation or an MRI, you are using up the budget of the institution in BC and Canada. Now, BC is a leader in trying to change this, I must say, but we're still not there. In all of the successful countries, the money follows the patient. So if you treat 1,000 patients a year, your institution receives more government funding than if you treat 100 patients a year.
And there's the same resistance to this, Dr. Day, as there is to resistance of paying teachers according to how well the kids do in class. We don't like meritocracies very much.
Right, but I mean, paying for work done and paying for performance and paying for excellence, I think rewarding excellence and rewarding efficiency are part of the reason that we don't do it, and that's part of the reason we're ranked lowly.
Okay, let's move on. We've got 4 more big questions. Number 4, the main health determinants are poverty, housing, and nutrition. Should government pay for these all by itself?
Well, if you follow the argument against a role for the private sector that governments bring up, and essentially every political party is on side with this argument, that it's more efficient for the government to do it because we don't have to take a profit out of it. We don't have to advertise. We don't have to spend all that money that free enterprise spends. So the point I'm making with this question is that you could apply the same argument to all of the other important services that governments provide. For instance, you should abolish all private schools, Catholic schools, Jewish schools, purely private. But every restaurant, every food outlet in the country should be funded and operated as a government monopoly. All houses should be built by the government and operated by the government because the profit motive is making them more expensive. I mean, that same argument would apply, and that's why the argument is, in my opinion, nonsensical.
But Brian, look at how successful the government has been at running Indian affairs.
Yes, and we would only have one. We wouldn't have a Shaw TV because we would only have the state-operated media system that would tell us how wonderful they were.
Yes, exactly, and show American programming at dinner hour. Question number 3. Physician and hospital services are government monopolies under the present system. Do monopolies ever favor consumers? Well, you would ask.
Yeah, I would ask, and again, not expect an answer, because, of course, there is no monopoly that I've ever come across, whether it be private or public. Either it doesn't matter who operates the monopoly, that is good for the consumer. A consumer benefits from competition, and we know from many fields that the introduction of some competition improves the service for the consumer, and I think that is almost a generic statement that can be applied across the board to services delivered to citizens.
Yeah, the neighborhood that I live in the shopping district where I live, has 7 banks. All right, they may all be remarkably similar, but believe me, that competition is good for me. I agree with you. All right, so question 2, we're getting hotter and hotter, and now it gets really personal. Question 2, your loved one, you or your loved one, are on a 12-month waiting list. Would you pay to get the right health care today? That's the question you ask, and you have asked politicians this.
Well, I've asked this of politicians, and so have others in the past, and
we won't name them because we're in the middle of an election.
We won't name them, but I can say that the majority of politicians will give you the answer that yes, they would let their loved one languish and suffer and deteriorate on a wait list because it's for the better good of the system. And really what they're saying is it propagates the status quo. Now, if you ask the same question about their pet, if you said, well, look, you've got a dog that's got is limping in pain,
yes.
would you let it wait for a year in pain, or would you treat it quickly? Would you spend your own money rather than going on vacation?
No, you take it up to Whistler and make it a sled dog.
In fact, I think the SPCA would probably take you to court if you didn't look after it expeditiously. So I think that really says it all, that yes, it's a question that they have to answer and truthfully.
And it leads to your last big question, and just barely have enough time for me to challenge you with a question, and that is question number one. You're free to spend your money on all kinds of discretionary, your after-tax dollars on discretionary things like gambling and alcohol and pet care. So why shouldn't you be free to spend your after-tax dollars on your own health care, is the question you would ask.
Yes, and again, that's a question that you will never get a politician to answer truthfully. And of course, it's in a free and democratic society, you should be able to spend your money on your own healthcare. It's an important thing for all of us. And we are the only developed country. In Europe, there is not a single country, including all the former Soviet bloc countries,
yes,
that deny a citizen the right to spend their own money on their own healthcare. Canada is alone in that regard.
Okay, so right now there's 100,000 people watching this show, and they're screaming, "But David, but Dr. Brian, if we allow people to spend their own money on health care, what about me? I can't afford that. So now I'm going to get the worst doctors, the worst nurses, and the dirtiest hospital."
Well, the exact opposite, because again, in the op-ed I wrote in the Vancouver Sun a month and a half ago, I pointed out that we also need a care guarantee. The government should guarantee, or at least the insurance, the private insurance,
yes,
should guarantee that if the government does not deliver the service within, say, 90 days, that your insurance policy will pay for it. And under the proposal that I put forth, everyone has private insurance, not like today. And if you can't afford the private insurance, the government pays the premiums for you. That's the way it is in Switzerland and Holland and many other social democracies.
So you're saying nobody gets left behind?
Nobody gets left behind.
A perfect world. Dr. Brian, I better come see you about that shoulder. Thank you so much for doing this. All right. Folks, that's our discussion of healthcare. Very, very fast, and obviously we need more politicians to talk freely about this subject. And you, boys and girls, should be asking your local politicians these very questions. Next week, we ask this: what's happened to all your stuff? By stuff, we mean mattresses, cell phones, laptops. What do you do with this stuff? Where do you throw it? Well, we've been finding mattresses in back alleys. We're going to have, I can't read that far, Brock McDonald. He's the Executive Director of the Recycling Council of BC, and we will recycle some thoughts about all of that. In the meantime, davidberner.com is the site if you want to email us or say hello. And thank you so much for being with us today here on Shaw Community TV, Cable 4.